Hi, YouTube. Today we're going to talk about diabetes. Diabetes type 1 is a condition in which the pancreas is no longer producing insulin to control your blood sugar levels. So, therefore, an individual that is diagnosed with type 1 diabetes has to take insulin every day to control their blood sugar levels. Diabetes type 2 is a condition in which the pancreas is still producing insulin, it's just not producing enough insulin to control your blood sugar levels. Diabetes type 2 can be controlled one or two ways. It can be controlled with diet and exercise, meaning that you're engaging in physical exercise at least 3 to 5 times a week. This physical exercise has to increase your heart rate, and with diet. That means that you're limiting the amount of concentrated sweets and carbohydrates that you are consuming with each meal. Diabetes type 2 can be controlled by an oral hypoglycemic medication that your physician will prescribe for you. You may take this oral hypoglycemic medication once a day or twice a day to control your blood sugar levels. It's important that any patient that is diagnosed with diabetes, that you're monitoring your blood sugar at least 3 to 4 times a day. Generally, we instruct diabetic patients to take their blood sugars before meals and at bedtime. Normal blood glucose levels are 70 to 100. Some textbooks will say 70 to 110. Never ever take any medication by mouth to control your blood sugar level or inject yourself with insulin prior to you checking your blood sugar level. I can't tell you how many times I have patients that I talk to, diabetic patients that I talk to, and I ask the patient, what has your blood sugar level been running at? The patient will say, well, Rhonda, I never check my blood sugar level, but I do take my insulin every day, or I do take my medicine by mouth. Well, I'm happy that you're taking your medicine by mouth or you're injecting yourself with your prescribed insulin dosage, but you also need to know what your blood sugar has been running. It's important that you write down what your blood glucose levels are and take those levels to your physician so that the doctor can see what your levels have been running at, and also to for the physician to be able to look at to see if there needs to be any kind of changes in your treatment regimen. Diabetics need to make sure that they're going to the eye doctor at least every 6 months. So that's twice a year. And you need to go to an ophthalmologist to check your eyes. That means that an ophthalmologist is able to diagnose you to see if you have a condition called diabetic retinopathy, which is a condition that a lot of diabetics have. It's important for diabetics to know that they should not walk around without shoes. You shouldn't walk around barefoot. A lot of diabetics have a condition called peripheral neuropathy. And with peripheral neuropathy, a lot of times a diabetic patient may not have sensation on the bottom of their feet. I've taken care of countless patients who have walked around with a nail in the bottom of their shoe for several days and not even know it. And when diabetics get wounds, a lot of times these wounds can be very, very hard to heal, because whenever you're diagnosed with diabetes, your blood your blood circulation slows down. And so therefore, if you have a wound that needs to heal, that wound needs to have good blood flow, a good blood supply to facilitate wound healing. It's important for diabetics to inspect their feet every day to make sure that they don't have any cuts or scrapes, anything on their feet that could lead to a diabetic wound. Also, it's important that when you're cutting your toenails, a lot of times diabetics will cut their own toenails, and sometimes you can cut your toenail and cut some skin accidentally on your toe, which can lead to a wound that may not heal, which can lead to an amputation of one of your toes, part of your foot, which can lead to amputation of your leg if a wound does not heal. I am not saying these things to scare any diabetic that may be watching my videos. I'm letting you know about these things so that you can make sure that you're taking the necessary precautions for you to make sure that you're going to stay healthy. Again, diabetics, it's important. I can't stress it enough to monitor your blood sugar levels. Again, my name is Rhonda Nichelle. I am a nursing consultant. You can find me on YouTube, on my YouTube channel. You can find me on Instagram at I am Rhonda Nichelle. Thank you.